Okay, everybody, welcome to our mental health first aid panel. My name is Hailey. I'm a senior at Clemson University this year studying health science. I'm very interested in mental health and the topic, so I'm really excited for this panel to see all of the great insight and feedback that we can get as far as our mental health first aid certification goes.
And my name is Molly. I'm a sophomore health science major at Clemson. The month of May is the Mental Health Awareness Month, and we at Clemson Paralympic Soccer wanted to provide more information to start a discussion about the importance and implication of mental health.
Awesome. Hey everyone, I'm Kirsten. I'm a current master's student in Parks, Recreation, and Tourism Management Department here at Clemson University, also working with Clemson Para Soccer. I am also an instructor for mental health first aid. So I help to run the courses for our veterans camps. I also played collegiate soccer as well in my undergraduate degree and completed a internship in a mental health hospital as well. So sort of lots of different backgrounds with athleticism, but also within mental health as well. So I'm happy to be here and I'll pass it on to Margaret.
Yeah, hi everybody. I'm Margaret Domka and I am a PhD student here in the same department as Kirsten, so the Parks, Recreation, and Tourism Management Department. And I have been involved with athletics at many levels. I played college soccer, but I also have been a referee from recreational soccer all the way up through the most elite levels. I refereed at the Women's World Cup in 2015, so I was also a FIFA referee for 10 years. So my interest in mental health has stemmed from all of my experience in sport. I think that many of us recognize that sport is incredibly important in our communities, but mental health is also really important. And so my research area while I'm at Clemson is in combining those two things and making sure that we are paying attention to mental health while we have athletes in sport too, using sport as a vehicle to provide better mental wellness to everyone who participates.
Thanks, Margaret. And I'm Dr. Skye Banning. I'm an associate professor here at Clemson University and the director of the Clemson Para Soccer program. I'm also a mental health first aid instructor, and we've included this in a number of our grant programs so that we can serve a whole host of folks in the sport environment, but also learning some mental health first aid.
Awesome. Thank you, guys. So kind of one of the first things we wanted to touch on was, Margaret, I know you mentioned the role of mental health in sport and just kind of your experience across the spectrum with athletics on varying different levels. So we kind of just wanted to hear a little bit more about that experience and just the tying mental health into sport in general.
Yeah, absolutely. So a lot of times with sport, we really pay attention to the benefits that sport provide. And there are a ton of them. There's tons of physical wellness benefits that happen. And there's also truly many mental wellness benefits too. We know that our athletes are able to have socialization and they're able to get mental wellness benefits just based on getting blood flowing and getting moving and getting some relief from their everyday life and things like that. And it's not just athletes, but it's coaches and it's parents, and it's anybody who's involved with sport can kind of have that different environment that they're in, and that's great. But sometimes we don't think about that there's also added pressures as a result of sport. So a lot of times athletes are traveling quite a bit. It means that their schedules sometimes are much more full. If we have athletes who are working on academics or jobs as well, it means they're trying to fit everything into their schedules. And then there's also other added stressors, things that can't be controlled, like if there's an injury and now they have to take time away from their sport and it's something that they have a lot of goals in and are dedicated to. Or I know that many of us know athletes who are super dedicated to their sports and it becomes part of their identity. So when they have forced time off, or even when it comes time to retire from their sport, they have to find a new version of themselves. And so some of those things really present real challenges. And that's where we need to do a better job of tying in mental health and sport. And up until now, so many of our discussions with mental health and sports are focused on performance. But we really want to focus not just on that performance piece, but first, we need to focus on people's wellness. And after they're well, they can perform better, but we need to make sure that they're healthy and happy first.
Yeah, I think that's super interesting too, because a lot of times we think about athletes as people who are really physically fit and physically healthy. But there's obviously that mental component that we need to make sure, we're checking that box as well. So
Mhm.
Kirsten, you kind of touched on your experience as a collegiate athlete. And I was just kind of wondering, were there any resources provided to you as your time as far as mental health goes? And if so, what were they? And if not, what do you kind of wish that there had been available to you?
Yeah, that's a great question and something that I think is really valuable to look at. I was trying to think of some of the examples of mental health support when I was a college athlete, but I really could only think of a couple. So, like Margaret said, I feel like a lot of the pressures was on performance, and although coaches might have, talked about how much they care about us and being a student and being an athlete. I feel like there was not that level of empathy and actual care for how we're actually doing. Coaches had a different agenda for their team, right? So they were concentrating on games and winning a performance, which is part of their job. So I understand that. But at the same time, I think Margaret brings up a great piece is like how would paying attention to mental wellness and sort of other areas of an athlete life, how could that then impact performance? So my school specifically, I believe we had a couple of mental health awareness sort of months that the student athlete advisory council that I was on that we had sort of led. So it was more just like general awareness events at basketball games. We had a couple of speakers come in and talk to us about mental wellness and their stories and things like that. But as far as individual support, whether that was from a coach or an academic counselor or a therapist, we really didn't have that individual care. So I definitely think that is an area for growth. And I know Margaret and Skye are sort of working on developing some sort of platform that can teach coaches and sort of leaders on how to recognize some of those signs and symptoms within their team, within athletes. But yeah, there's lots of work to be done as far as providing that support for college athletes. So.
And then, Skye, did you have any information about how coaches could be more of a provider for this role in mental health in our athletes?
Yeah, so I think for me, the one of the important pieces to remember, and maybe it helps with the stigma that coaches can approach, is that we all have physical health. And I think coaches recognize that their athletes have physical health, and sometimes they're better, sometimes they're not as good, which is why they train and continue to train. And in a similar light, excuse me, we all have mental health. And many of our mental health sort of changes and ebbs and flows based on emotions or events of the day even. And certainly understanding that I think that might help break down some of the stigma around mental health, that this is a spectrum just like it is in physical health, and that certainly helps. From a coach's perspective, again, I think recognizing and being able to acknowledge that when their athletes show up on the field that day, they may not know what their athletes have gone through in that day. It's been something really traumatic, and there needs to be time for an opportunity to just sort of address those things again beyond the physical training. And maybe that there are organized activities or organized events to allow their athletes and coaches to interact in that way. Or maybe it isn't even a coach. Maybe it's bringing in an administrator or another healthcare professional that can sort of act as that sounding body for folks to be able to resonate with one another and sort of connect with one another in a different way, not sort of in an on the field or on the court sort of physical way.
Yeah, and I also think there's room as well for within the teammates specifically. So we've talked about coaches and sort of leaders above the athletes, but I even think that there's been more awareness now within like younger generations on the importance of mental wellness, and there's been lots of movements. And I would really love to see that within the athlete community, is because when I was a player, like I think back to my times during practice, during games, where mental health was not something I really knew how to help someone. But it was happening. Like Margaret talks about those pressures, and they're so real within that environment, especially when identities are being tied to that sport. So I think that would be super awesome to sort of look more into how we can equip now youth and teammates on high school teams and college teams on how to help a friend that is struggling with a mental health challenge as well. So coming at it from a variety of angles, I think, is really important.
Kirsten, I'm actually going to pick up from where you just left off, because you mentioned that you felt like you didn't know how to help. And I think that some of our stigma comes from that same place for a lot of us. I think there's a fear of talking about mental health because we don't know enough about it in general, in our general population. So because of the lack of understanding, and there's so many myths out there about mental health, we're afraid to start the conversation. There's myths like believing that someone who has a mental health issue is going to be violent, which has been found to absolutely not be true. Kirsten and Skye and I are all mental health first aid instructors, and we've learned about several of these myths that just aren't true about mental health issues. Or believing that someone who's having a mental health issue, if we talk to them, we're going to make it worse, or we're going to make them think about things like suicide or other things that they wouldn't think about otherwise if we hadn't ever had the conversation, which is a scary thought if we aren't understanding how to best help someone. So I feel like then we just stay away from it. And coaches, it turns out that in young people's lives, parents, of course, are super important as mentors and people that young people learn from, but kids are also the second and third most important people in kids' lives are teachers and coaches. And so we need to take the time to start educating coaches about mental health a little bit more, so that some of this fear can go away and people can understand better how to talk about it and not feel like they're going to make it worse when they do talk about it.
So then moving into more of like a general idea of mental health first aid and how it affects a whole population of people, can mental health benefit really anybody outside of just athletes? What about like our veterans or, as we mentioned already, like our coaches and anything, like a more general population? This is for anyone, sorry.
I think the nice thing about the mental health first aid modules, at least, is they really are tried to target them to particular audiences. There's sort of a general adult, a general youth, but then there are very targeted ones toward veterans, toward first responders, toward teachers. So they recognize that while mental health and sort of the nuances of mental health might be different for each audience, there's still the general story, the general theme, the general conversation is really still the same. The process in this case is the same, but really the goal for all of those entities are really just to, again, break down stigma and make mental health a greater part of an everyday conversation, so that people are more aware of it and confident and comfortable talking about both the good and the bad days, and not to be afraid to do that.
That's all really great information. Thank you guys so much. That's all the time we have, but please feel free to refer back to that initial slide with our website information. And if you have any questions or anything like that, please feel free to reach out to the contacts on those websites. But thank you guys so much.
All right, thank you.